Hello and welcome to Living Well in Montana. I'm your host, Tanya Thomas. Living Well in Montana is a program brought to you by Living Independently for Today and Tomorrow, or LIFTT. We're one of 4 centers for independent living here in the state of Montana. And I'm going to introduce my special guest today is Meg Traci. I'm going to have Meg introduce her title because I know I'm going to mess it up. Meg comes to us from Missoula and the University of Montana. Meg, welcome.
Thank you, Tanya. It's great to be here. So my title at the University of Montana is Research Associate Professor, and I'm at the Rural Institute for Inclusive Communities at UM.
That's fantastic. Can you tell us a little bit about yourself, how you came to this career, what drove you to do this work, and a little bit about what the Rural Institute does?
Sure. Yeah. I'm gonna take the Rural Institute first, just to kind of set the context. So, in the U.S., we have what's called the Intellectual and Developmental Disabilities Act, and it funds 3 entities in every state. It funds our Developmental Disabilities Council, it funds disability rights organizations, and it funds University Centers for Excellence in Disability Education, Services, and Research. And the Rural Institute is the latter. It is the University Center in Montana. So the DD Act builds out a network of university centers nationally. We all work together to leverage the resources of our universities to improve lives with people with disabilities. Our DD councils work together nationally to improve lives with people with disabilities, but really using more of a social planning advocacy approach, really working with the state government and different programs run by our state governments to support people with disabilities to make sure that those programs are accountable to the community that lives with disability. And then our disability rights organization work hard to protect the rights of people with disabilities, and there's a national network of disability rights organizations. So we all work within our national networks, but then it's also really important at the state level that we work together, each of us taking our own approach, working with the community of people with disabilities to make lives better. So the university is going to have their approach to working with the community, disability rights organizations and DD councils each have theirs, but it's really important that we combine our agenda to work together towards shared goals.
Okay. I love it.
Yeah.
I love.
And so, yeah, thanks. I got into this. You asked that, right?
Yes, I
yeah.
did.
So I really got into this by a series of opportunities. You know, I feel incredibly fortunate to be working with people like you and with our Centers for Independent Living almost in a very easy kind of way after many years of work together. And, you know, all I can say is that we've been incredibly fortunate, right, to have these opportunities. Absolutely. So for me personally, that meant, you know, that I was born into a family that had people with disability. And so it was part of my lived experience to know people with disability and to see how our family values are appropriate for everybody, you know, that we treat each other with respect. And I also had the opportunity to see how hard my grandmother worked to try and keep us connected to family members who at that time, my uncle, you know, he was, her home couldn't accommodate him. There was nothing like personal care assistance or home and community-based services. And so when my uncle got to be too big for her to carry and care for in their home that had a lot of steps, you know, he went to live at Dixon, which was the institution in Illinois, and I just saw how hard she worked. You know, she got on the bus at least once a week and, you know, traveled on the bus down to see her son and bring the photos and tell the stories and keep us all connected to my uncle, her son. And so I got to see both how you can include people with disability in our family life, but also how painful it is when they're excluded. And she was very, she would share that too. And so I think that motivated me and my cousins, and in one way or another we all continue to try and work with people with disability in our work lives, our personal lives, to try and make our communities more inclusive and better places to be so we can all be together. And so for me, that meant going to school. I went to graduate school at the University of Montana. I did my doctoral work with Lynn Kester. I was the first experimental psychology student emphasizing in developmental psychology.
Wow.
And Tom Seekins gave me a job after, he started to do some work around health with people with disabilities in the late 80s, some of the first work anywhere in the world, actually, here in Montana, with some great disability advocates through the Centers for Independent Living and other advocates, and started to grow a program we'll talk about, Living Well, and was talking about that at our DD Council. And he tells a story, and I'll have to check, but I think it was a local Billings family advocate who literally shook him by the lapels and said, you need to do this work with people with intellectual and developmental disabilities. And that's where I entered into that agenda. And so I, as a graduate student, had the opportunity to start working with families and adults with intellectual and developmental disabilities in the state, doing my job, which was reviewing all the scientific literature, putting together the summary of that literature to bring to people and say what's missing, start to develop surveys with them that could fill those gaps. We started to collect data, and we started to build some programs. So when you do that kind of work, you form relationships that, for me, are seeming to last a lifetime. There are a lot of promises made as a young researcher that we're going to make things better, and when we're talking about social change, it doesn't happen overnight. So here I am 25, 30 years later, Tanya, still doing somewhat the same stuff.
But have you experienced, what changes have you experienced? And I know you said it doesn't happen overnight. What have you seen? What have you seen change? What have you seen that you want to change?
I'll point to, one of the big changes for us is that initially we were doing research, right? In the 1990s, we were doing a lot of research, and you needed research kind of money to collect data about health with people with disability, and that's, and today we collect data about health of community members, including people with disability. So in Montana, we have questions so people can identify as a person with a disability on our public health surveys. And so then we can say not only how is women's health? What are some of the important things we need to plan for and work on with women's health and men's health and American Indian health and different age groups. We can also say, what does health of people with disability look like in that same kind of conversation? And we can start to set goals for improving opportunities for health promotion, working on healthcare and making it more accessible and appropriate for people with disability. We used to have to do that, as a research project to get those data. And today, we are able to think about people with disability, not necessarily disability as an outcome of health or part of health, but as a community, as members of our community, and look at the health that is the health data that we have for those members of our community. So that's different, and and very important for us. There's still work to do in that regard, but that is one of the big changes, and there is momentum there. So
That's
I would say that's right. And I'll also say, that, when I started, we didn't have formal relationships with public health and our Centers for Independent Living, which, for folks who don't know, they are a disability-led organization. They are people with disability who work there. Their board is 50% or more with disability. And so when we think about what is the agenda, we have to follow their lead, right? There's nothing about us without us, right? That's right. The motto of the disability community. And so over time, I think public health has said, and public health in their kind of role in communities or at state levels or nationally, internationally, we convene community members to set the agenda for improving community health. And so it's been really great to see how public health is now embracing centers to bring the agenda that disability-led organizations define into the broad community agenda. And that, that we used to talk about non-traditional partners in our public health work, in the late 80s, and now we're really talking about inclusion, whole community approach, equity, and not saying, oh, those are non-traditional partners, as if maybe we don't ever need them to be traditional. Instead we're talking about them in a way that we're planning together, and I guess a way that I think centers those voices a little bit more, right?
That. Yes, I like that.
Yeah. So I would say those are some of the big things that I've seen. Some of the things that I'm super excited about, right, are that, we have some new tools from the Department of Justice and the Access Board. What do we mean by accessibility? Well, we have to define that. And we have things like the public rights of way for accessibility, the guidelines, the PROAG, and that gives us, definitions, words, measurements, tools that we can say, oh, here's what we mean by that. When we talk with our healthcare providers, what do you mean by accessible diagnostic or screening equipment that will work for somebody who may need to sit for a procedure, or somebody who may be in a wheelchair and needs to get onto the exam table? Tell us more. What do you mean? Well, now we have from the ADA Access Board, we have guidelines on what does that mean for adults. What are the words, the measurements? What are the examples of what an accessible piece of equipment will look like for certain diagnostic tests or certain screening tests? And, we just didn't have those before. We have those today, which
That's
is great.
such an important change.
Yeah.
It makes such a difference to be able to express exactly the things that we're needing or what would make those differences for us. I think you're absolutely right.
Yeah, yeah.
So I know you through facilitating Living Well in the Community.
Yep.
Can we talk about some of the programs that the Rural Institute offers?
Sure, absolutely. I want to start with one of our programs. So the Rural Institute, all of us are grant funded.
Okay.
We get a core grant from that IDD Act, but it really is enough for us to kind of establish a department on campus. And so if you've seen one university center, you've seen one university center. We're really defined by the grants that we organize with our community members and that we operate. And our only direct service program, like where we really have something that we could give somebody today that will help them, is Montech, which is a super important program. And I just want to lead with that. And these are my colleagues, at Montech, Molly Kimmel and her staff. It's our state assistive technology program. And if people haven't heard about Montech, I really encourage you to get online and just see the equipment.
We did a show on Montech.
Oh,
so
good.
Yes, it was a great show. Very wonderful resource.
Oh, fantastic. Okay, great. And then another one of our big grants is the Research and Training Center on Disability in Rural Communities. And I'm on that team as well. It's funded by this Administration on Community Living. It's a 5-year competitive grant. And we do a lot of research projects with rural people with disability across the country. And I would say that's really where we think about healthy community living and some of the tools in that platform, which include the Living Well in the Community program. So that's kind of where we are today with Living Well. We think about it as the RTC Rural, and a program that we nurture through the RTC Rural with some other funding from ACL and other foundations. And then we work really hard to make that available nationally through our networks of Centers for Independent Living. And in Montana, we've been very successful over the last 20 years, with you and others, making that program a part of the portfolio of what our Department of Public Health and Human Services Chronic Disease Prevention and Health Promotion Program offer. So they offer things like the Quit line and fall prevention programs and diabetes prevention program and diabetes self-management education program and our breast and cervical cancer program. Wonderful programs, right, that we really promote throughout the state. Well, now we have Living Well in the community that we also promote with all of those other programs to say, as a state, we care deeply about the health of everybody. And our portfolio has this program that's been developed by, for, and with people with disability, which is the Living Well program. And it is designed to address secondary health conditions that can be really limiting and can end people's lives early. Things like pressure sore, depression related to disability, urinary tract infections, early signs of bladder cancer, equipment failures. And so all of those things are addressed within this 10-week workshop in the same way that these other workshops might help you to quit smoking or might help you to organize for some healthy living goals that can help prevent diabetes. This program really helps people with disabilities to understand that they can have meaningful life goals, that it structures peer support so that when that negative thinking that comes from perhaps a lot of oppression that a person might experience, the daily hassles of not having a curb cut or a personal care attendant not showing up or somebody saying something to you because you might look different, all of that adds up and can affect your mindset towards meaningful life goals. So Living Well helps to kind of structure peer support and help people to attain those goals together. And we have that program now, similarly to like the other programs that I mentioned, Quitline and some of the others. They're available statewide, and we try to make Living Well available statewide, working with our Centers for Independent Living. So if you're interested in this program, you might be new to disability, you might have had disability for your whole life, or you might not be sure you have a disability, but something's going on, and somehow you are not achieving your life goals in the same way. You need some different tools. You need to organize differently for your health. This program is something that I would encourage Montanans to call their local Center for Independent Living, learn more about it, and see if it's what you need, or maybe your CIL might have some other things that might be helpful to you. So the history of Living Well, though, is 30 years old, and I don't know if I want to go there, Tanya, but I will say, initially when the royal we, that when Tom Seekins and Craig Graveslud and Julie Clay and some others worked with Centers for Independent Living to collect the data on what were the most limiting secondary conditions, what were the most limiting health problems that people with physical disabilities had. And they had a good idea of what those were and also some of the reasons for that. They came to the Centers for Independent Living and said, why don't we do like a case management program and really just line an individual up with somebody who can help them to connect to resources to prevent their secondary conditions. And it really was the CILs who said, no, we're not doing case management. We're about peer support. And there's so many different ways to approach secondary conditions depending on who the person is and the life they lead and the goals that they have, that it needs to be a peer support model. And so that was well before we did this kind of group facilitated health promotion programming. And so I watched. I was doing the other stuff that I mentioned before, but they really organized with the Centers for Independent Living to develop the Living Well in the community curricula to leverage the peer support of the disability community. And you'll hear things like, what cushion can help prevent pressure sores. You'll hear that information exchange in this kind of class, or who helped you build that ramp into your house, or where did you get the hand controls, or we were talking about the talking library. Like how do you use that? What's a good book you checked out? Just that kind of community, that kind of support. Solving the small problems and then solving the big ones. Who do I talk to at the Social Security office because I've really gotten the runaround? those kinds of things can be really a part of this structured conversation and help people to stay on track, reach their goals, and then learn more about how physical activity, nutrition, good conversations with your healthcare provider, good stress management, how all of that is part of, reaching your goals, whether it's going on a trip, getting a job, or whatever. So that's living well. Did I say too much?
No, it was great. Living Well is a wonderful, wonderful, wonderful course. I can't say enough about it, and the dialogue that it opens up for people that maybe were afraid to ask or are just learning about themselves and accepting their disability, learning to live with it healthily. It's a great program.
Yeah.
Love it.
Thank you for all your support.
Absolutely.
Getting that more
We're
available.
excited to be getting it going again. Yes. Yeah. Now, I heard you were in town for a walk audit. Mm-hmm. And I heard something about accessibility ambassadors. What?
I've got my kicks on.
Oh, you've
been walking.
Ready to walk. That's right.
Yeah. Mm-hmm.
So can you explain to us what you're doing here, what the walk audit is?
Sure.
What's going on with that?
Yeah. So we're here for the Montana Association of Planners Conference that was hosted here in Billings by, Elise Monat and others. And so we have had the opportunity to work on a model that really softens the ground and strengthens relationships that are needed for some of the changes in our community that afford better access to active transportation, whether you're a pedestrian or using your bike or scooter or skateboard, or you're riding the bus. All of that is seen as like active transportation and an option to being in the car. There's lots of reasons why active transportation better supports health, whether it's the incidental physical activity or the greater feeling of community connectedness. But there's just a wealth of reasons that we've entered this space. And the CDC and my really good colleague, Chris Kachitsky, who passed away early in the pandemic, and others like Shannon Griffin Blake at the Centers for Disease Control and Prevention, I think they had this part of the agenda, healthy communities, and why we care about that in public health. And it really was Chris. I would say it was Chris at the national level saying, and people with disabilities have been fighting through the disability rights agenda to build out more accessible communities so that they can be in the community and not in nursing homes, since the 80s, 70s, maybe even before that, and there's a lot of synergy there. There's a lot to align in trying to build out trails where people can get their 30 minutes of exercise, or bus stops that are encouraging people to get the 10 minutes from their house to the bus stop and their 10 minutes home, and then 10 minutes somewhere in between, you've got 30, right? They're like, yeah, and it needs to be accessible, and people with disabilities have a lot to say about that. So at the national level, there was all this work going on. But then in Montana, Kathy Kostakis and the Department of Public Health and Human Services organized for I think between 2013 and 2018-ish. We had a series of workshops called the Building Active Communities Initiative, and 5 or 6 communities would come to a 2.5-day workshop to learn from one another and from some national experts and experts from the Department of Transportation and our Department of Commerce and other planning groups. How do you, as a community group of 5 or 6 people who travel to this workshop, sometimes the mayor, sometimes city councilors, the planner, the engineer, local advocates, how do you make those changes in your community? How do you turn it around? And so over that time span, 6 or 7 years, I think over 20, maybe 22 or more communities in Montana engaged in this process. And at the core of that process was the walk audit, which Dan Burden and Mark Fenton have really, used nationally, internationally. And Kathy Kostakis said to Mark Benton when he was leading these workshops, you need to be hearing from the disability community, and that was really how we built our nutrition and physical activity program with our state disability and health program. We could work together. Where was our common ground? And so at those workshops, I would share some information about, different funding that's available, different data that's available to guide planning, and different partners who are available. And then we would have a disability advisor really talk about, what they were doing as an individual or with their organizations to build out more accessibility in the sidewalks and in the crosswalks and in the bus stops, and just really tell why that was so important at a personal level. And so we just kind of started to do that. And over time, I think Mark kind of shifted his model to be, he always had this interdisciplinary thing. It was kind of novel to have a public health person along with your city planner and city engineer. So this interdisciplinary group was kind of unique, and together they had important conversations they didn't always get to have when they were doing these inclusive interdisciplinary walk, move audits, these workshops with community members. But he saw that none of those three entities, while they all maybe understood it, maybe had specific training in it, understood the code under ADA, nobody was really bringing forward the perspective of people with disabilities in the same way that our disability advisor was on those walks, at those workshops. And so we, with funding from the National Association of Chronic Disease Directors, we rewrote some of that curricula with Mark and did some of our training. I'm not sure if you came over, but Jed came over with Elise Monat to one of our workshops where we trained Centers for Independent Living and different folks and working as planners or engineers on this approach. And so the team became public health, city engineer, city planner, public works, and then somebody who has expertise in the ADA and lived experience with disability. So that things don't get missed. I mean, I've been doing this work 30 years, Tanya, and you've seen me. I miss it.
Yeah.
I'll be like, oh, that was bad? Oh my gosh, you're right, that was so bad. That curb cut was so steep, or that little heaving of the sidewalk was a big trip hazard. And so we try to scout the route and anticipate some of that. But anyway, the long story is, with that training, Elise and Jed came back to Billings and started to do some of those here. And so then when Elise had a role in planning for the conference, and she got input from Jed, and I was like, yeah, let's do I think we did that training in Helena that they came to before the pandemic, so a while ago. And so we thought if we could collaborate and bring Mark Benton, and Karen Korb was able to come as well. She does some of the training at the Walkability Action Institutes that are held nationally by the CDC. Okay. If we could build them into the agenda at the MAP conference, that would be awesome. And it happened. So I'm here.
That's so great.
Yeah. So we did a big walk yesterday and introduced some people to this approach. And
that's wonderful.
Yeah, it was good.
Will you look at the clock for me? Tell me what we have left. It's under the monitor.
Oh, okay. It says 9950.
All right. So thank you for that. I appreciate that accommodation.
Yeah, you bet.
So what happened with, what do you guys do when you're on the walk audits?
Right. Yeah, super fun. I have to say, we do try to, the team tries to identify a route where there's going to be a richness of learning opportunities, right? Okay. So we usually want to see, like, if we can, a school. We want to be able to see, like, a transit, where's a transit center, or we want to be able to see, like, are there healthy places to eat and unhealthy places to eat? We want to see, like, really great examples of design that support people to be out and about and out of their cars. And we also want to see the worst, right? So it's this kind of approach that's pretty intentional. So the route is defined by the team, and people with disability are looking and saying, this is really an important teachable thing to learn about truncated domes. And here's a curb cut without truncated domes, and here's a curb without a curb cut. And so how are we going to manage that, but building in those teachable bonus and as best you can. But then when we're all out together, everybody has something to learn from one another. And so that's one of the big things, is that we just really want it to be this reflective, shared discovery. And so there is some planning, but then we really are planning for conversation. That's, and really getting a good facilitator ready for that. So people will travel in the group, and then we kind of stop periodically, and we use kind of, as a psychologist, I see it as this motivational interviewing tool. People will rate things on a 0 to 10 scale based on their impressions of, is this on a route that's connecting me to places I want to go, and how accessible and safe is it, and did I enjoy being in this space? Do I feel rewarded for being here? And then there's one other element. I'm not going to close this up. I might, but anyway, if people are really encouraged to think about all 4 things. Maybe it's site design, I can't remember, but and you rate things on a scale 0 to 10, and 10 being the best, 0 being the worst, and just the whole group just says their number, and then some are low and some are high, and that's fine, that's fair. And so then people learn and share, why'd you score it high? Why didn't you score it higher? Why'd you score it low? Why didn't you score it lower? And so we learn in that way, and then we go back after the walk move audit and do some planning and say, and we really try and not complain. We're like, so what did we, that's what we observed, so what are we going to do about it? So what policies?
That's awesome. Meg, we're out of time.
Oh, good.
I've got to interrupt you. I want to thank you for coming. Quick, how can we get a hold of you? How can we get in touch to learn more about the Rural Institute and what you guys do?
Sure. We have our website, the University of Montana Rural Institute. If you go to umt.edu and just in the search Rural Institute, you'll find us. And if you Google me, Meg Traci, Traci, you'll find me. My email is meg.traci@mso.umt.edu, and my office phone's 406-243-4956.
Thank you so much for joining us, Meg.
Thank you, Tanya. It's great to see you.
Awesome. We'll see you next time on Living Well in Montana.